8-year-old visitor who arrived on the island on Friday the 13th from the United States, and a 39-year-old Barbadian woman who recently returned from the U.S. Now joining us live tonight to discuss this revelation is our Acting Chief Medical Officer, Dr. Kenneth George, and Barbados COVID-19 czar, Richard Carter. Hey, good evening, gentlemen.
Good evening.
Good evening.
Okay, we just heard about the two patients, those first two COVID-19 patients. What more can you tell us about them?
So, as you know, these are very uncertain times, but the Ministry of Health and Wellness has been preparing for this event for a very long time. And we got notification of a positive test in the wee hours of this morning, and we acted immediately. We put there are two persons, there are two female individuals, both traveling from the United States of America, and they have been put, one in the isolation unit, and the second person has been placed in the Paragon facility. They're not very ill at this point in time. Let me be clear, we have tried to indicate to the Barbadian public over and over that Barbados was never going to be excluded with the arrival of COVID. And I think that on our journey, what we did was we said to the public, we are going to improve our surveillance. However, that has shifted, and as we go to stage one, we need to go to mitigation. So we would like the public to work with us through this difficult time. This is not the only time that Barbados has felt a public health difficulty. Let me reiterate that 80% of cases will have mild disease, and those cases will not be required to even interact with a healthcare facility. There's an additional 10% who will require more invasive monitoring, and then a 5% which will require, let's say, ventilatory support, etc.
Okay. And of course, I'm throwing this question neither of you can answer. I heard you say, Dr. George, you found out in the wee hours this morning. I just want confirmation of that, because we've been hearing a lot of things about the government knowing from before and covering up. So
absolutely
what time
not.
do we know?
No, absolutely not. As you know, there's an EOC that works 24 hours, and the EOC never stops. This information was revealed to us through the Best DeSantis lab, who have been working very late hour shifts, because we believe that we have enhanced our on-the-ground testing. Yesterday we did 14 tests. Today we did 10 tests. Once persons, and we have made sure to let the public know that we are willing to test once they meet certain criteria. We have scaled up our ability to test. Let me let the Barbadian public know that at present we have the facility for 600 tests, and we are going to be ramping this up with respect to having those kits available.
That's one of the things people have been asking, how many tests do we have available, and how many people have we tested so far? Right,
so we have been testing over the last week. We have tested to the point where we ran out initially, but we got some stores. Remember that Barbados is part of the global community, and everyone wants to be tested.
Yeah.
And therefore, let us work with you to decide. The other key issue is that we need to work with our partners, Barbados Association of Medical Practitioners, and the polyclinics, or medical officers of health, and persons within the primary healthcare system, because as this condition becomes more common, we hope it doesn't, these persons will be interacting with our primary healthcare facility. And I am happy to report that we have been doing a lot of work with them, and I think they understand the risk, etc.
Okay, let me bring in Mr. Carter now. Can you tell us anything about that flight? Do we have the flight number? Because Barbadians are asking, and a lot of them are asking on social media, and I have to look up for my people on Twitter as well. They're asking about that flight number, and is there a risk for anyone else exposed that could have been on that flight? How are we tracking that?
Well, I think this is a question really for the health official who's to my right. But obviously the flight would be known, because that would be part of the contact tracing that is being done and undertaken by the Ministry of Health. I don't know if Mr. George, Dr. George wants to make any further information.
Yes, so we have said that in this early phase, contact tracing is absolutely required. This is a methodical way where we try to go back into the person's history and see where the contacts were made. So that process has started. We have engaged the airlines. We have been extremely upfront. We have engaged the airlines to let them know what our thinking is, and they have agreed to work with us. So I think it is, with respect to contact tracing, yes, this will be a priority, and contact tracing is a very methodical and slow process. It's extremely deliberate.
Can you give us the flight number?
No, I don't know what the flight number is. What I would say is that it was on a JetBlue Airlines.
A JetBlue Airlines.
Yes.
Okay, what about the people that have been in immediate contact? Because we heard that one person came in on the 13th. First of all, we said the other one was recent. Well, how recent is recent?
The information that comes to me is that both persons came in on the 13th,
Okay.
on Friday the 13th. Of
People that have been in close contact with them, have they been tested?
Well, we intend to do so because the close communicants of those individuals, yes, they will require testing, and they will certainly require testing if they have symptoms. What I will tell you, I'm happy to report at this point in time that the close contacts have not been symptomatic.
Okay.
So we believe that we have caught these two cases fairly early in the game, and we believe that our surveillance system is working.
Okay. Mr. Carter, we're at stage 1. Walk us through that stage.
So essentially, we have basically moved since the notification today to stage 1, which means that we have a confirmed case. In this instance, 2 cases. What this has meant immediately is the standing up of the Augmented National Security Council. Now, this is a multi-sector agency of government because we've stressed from the very beginning that this is going to require a whole of government response. Dr. George has been speaking primarily about the public health response to this and the health response to this, but there are a range of other issues that have to be dealt with and have to be taken into consideration in order to ensure that we mount the level of response that will protect the country as much as possible, mitigate its impact, and ensure that we provide the available resources to the population to deal with this. So essentially, we have actually examined a number of the protocols. We have issued a statement today indicating that visits to elderly care facilities, whereas we had asked for a restriction in relation to the number of visits by the public, those visits have now been restricted entirely because we know from the science, we know from what we've seen is that the elderly population is particularly at risk. We've also come to a number of discussions and decisions in relation to public gatherings. I believe the Prime Minister has made an announcement in relation to restricting public gatherings. We're also going to be recommending to our stakeholders coming out of the Augmented National Security meeting, which I believe is probably still going on, a number of communications with respect to public transportation, public gatherings, the indication in relation to the public sector and the private sector. We saw responses today again that were a reflection of panic in terms of the response from the general public. And again, the Augmented National Security Council has basically been considering the supply chain, ensuring that we are properly prepared both in terms of medical facilities and medical equipment that is required for the intervention, as well as the supplies of basic necessities, drugs, and so on for the population of Barbados.
Okay, it would be remiss of me if I didn't ask, because you're talking about we're into stage 1 and you have all the protocols following. Today, what would have been the decision been like surrounding knapsack? Because the announcement came during knapsack almost started. How was that process this morning?
Yes, so the knapsack, I believe, had already started, as you said, when the decision, when the communication was made. It would have been more difficult to go into the stadium and stop those little ones from traveling. And besides, we would have evaluated this in terms of the risk. Yeah. Now, having identified 2 imported cases and that is a success actually of our screening and testing system, 2 cases that were immediately or more or less immediately isolated, what is the risk to children at the National Stadium who would have had absolutely no contact with these persons? And that was basically the decision that was made.
If I feel like I'm showing symptoms, something else some people are asking on social media, what do I do immediately?
Right. So you know there's a hotline that we have
Yes.
established, which is going well. We have identified that there are 3 polyclinics that persons can go to: the Winston Scott Polyclinic, the Morris Bayer in the north, and the
Randall Phillips.
and the Randall Phillips in the south of the country. We have identified those clinics as the persons can freely go, interact, let the public health nurses and the doctors know the issues up front, and you will be marshaled through the system. There's a plan for that. We believe that the general practitioners also have a role to play. We have issued just some simple guidelines as to how to protect themselves and how to protect their staff, etc. I believe that persons in Barbados should listen to the competent authorities and try to work with us, because, as I said, we don't have all the answers, but our preparedness over the last 6 to 8 weeks has put us in a better place. We were one of the first countries to institute testing. We were one of the first countries to say that we were ready for the isolation unit. So we have been ahead of the curve, and the Prime Minister has indicated to the country that there will be no resource that would be spared to make sure that Barbadians are protected at the end of the day.
And Shane, I just wanted to say that it is actually an indication of the availability and the use of testing, because we were able to get the result within hours, because we do have testing facility here in Barbados, which means that we did not have persons basically going around waiting until the results of a test came back for 2 days, as is in the case of many other places.
Thank you so much, gentlemen.
Thank you so much.
Okay.
You're welcome.
Thanks.
Thank you.
Okay.
Okay, following the confirmation of the 2 COVID-19 cases, Parliament decided to postpone debate on the appropriation bill until this Friday, March 20th, 2020. Leader of Government Business and Education, Minister Santia Bradshaw, made the announcement during this morning's brief 10-minute sitting.
We have therefore, as a government, decided that we would move to postpone further consideration of the appropriation bill at this stage until Friday at 10 a.m., the 20th of March. But I want to take the opportunity to remind all persons that stage 1 is obviously a step up from stage 0, which is where we were just a few hours ago. And stage 1